Okay, so again, welcome to this second session on our training course as part of the EASMH project. And today we will talk about on the importance on how to create a good relationship with our patients and how to engage patients with severe mental disorders in a sport-based intervention. And this is the program of the today afternoon. First of all, I would like to start with a very short recap summary of the previous session. And considering that several weeks have passed, I have just picked some of the slides from the previous lessons, and I will show you in a second, just because I guess it is very important to have a clear information regarding what is mental disorders, what is schizophrenia, depression, and so on. But also please consider that there is available the registration, the recording of this previous session, and you can also take your time to see again all the recording and just to clarify any aspect that it was not so clear. And recap, I would just remember you that as we already discussed, we know that severe mental disorders are a very heterogeneous group of disorders in which we can list disorders like schizophrenia, like depressive disorder, like bipolar disorders, and that these disorders have some specific feature that now I will try to shortly describe to you. And that first of all, you know that schizophrenia is characterized by some symptoms that are also called positive ones, that are delusions, disorganized speech, but also we have some negative symptoms like flattened affect, reduced speech, lack of initiatives. Why it is important, according to me, that we talk about these symptoms? Because of course, if we decide to include in the pilot action that you will perform in the next coming weeks a person with schizophrenia, you should be aware of what are the main symptoms that this person can suffer from, because of course this can influence the way in which you approach the patients and decide to develop the project, the sport-based intervention. And again, this is the details of what are positive, negative, and also disorganized symptoms. And I would like to you that if you have any questions, please free to interrupt me and ask me everything, because you know, this is not really a lesson, but that this would be a sort of really a virtual meeting in which everybody is feeling free to ask me questions, because you know I am sort of expert just because I am a medical doctor, but here I guess that the real expert people are you, because you have the expertise, the skills for improving from leading sport-based interventions. So please feel free really to interrupt me or to ask me anything if it is not clear to you. And then we talked about depression, and probably you know what is depression. Depression is not only having a low mood, but it is also experiencing changes in appetites, changing in sleep patterns, having difficulties in concentrating, having agitation, fatigue, and all these aspects have a significant impact on the personal and social functioning of the person, and so she or he is not able to perform any activity in his or her daily life. So it is a very impairing and disabling condition, and it is also important to correctly manage and formulate the diagnosis for people with depression, depressive disorders. And finally, we already talked about bipolar disorders because bipolar disorders is part of the affective disorders cluster, and but people with these disorders experience the alternation between the manic phase in which the person feels like he or she can do everything, that can afford any type of activity, is easily distracted, is overconfident in his or her abilities, but at a certain point, this phase of the disorder is interrupted by the fact that they will start to experience depressive symptoms like low mood, significant change in appetite, thinking about suicide, also about self injuries, and also feeling fatigue, lack of energy. And so also this is a very severe mental disorders, because the fact that you have the alternation of these two phases is very difficult to be managed by the patients, because of course he or she needs to cope with both phases of the disorders, and it is not really so easy to carry on with your daily life. And finally, in the last session, we also discussed about the fact that nowadays we have several treatment strategies for treating people with severe mental disorders. And we know that these strategies should be personalized and adapted to the specific needs that every person has. And that, first of all, it is important to consider that this intervention should be integrated with pharmacological ones and non-pharmacological ones. And this is the reason why we, in this EASMH project, are aiming to improve the opportunity to provide people with severe mental disorder with non-pharmacological interventions, like the ones that include a sport based on an exercise component, because we know that this component can be very, very important. And just for summarizing the last part, I would like to remind you that most commonly used classes of medications include anxiolytics, antidepressants, mood stabilizer, and antipsychotic medications. And so these are just some of the names of these drugs that I would like just to show you, just for remind you that probably the people always know the type of pharmacological treatment that they are adherent to. And so it is also important for you to know which kind of medications they are taking. And also because you should consider that medication have some side effects, and that in part can explain I would say some of the behaviors of the difficulties that people can have in their daily life. So again, it is very important to have this very elementary, I would say, knowledge regarding different classes of drugs, just because you should expect some kind of side effect when a person is treated with a specific drug instead of another drug. And these are just some brand names, and this is the type of medication that is provided to them. These are just of the most frequent side effects that we can see, like sedation, like dizziness, like apathy, fatigue, like gastrointestinal disturbances. So as you can see here, the side effects can really involve any district of our body, and so it is important to know that these effects are possible. And this was the final slide based on the lessons that we have in March. So now, before moving on, I would like to ask you, and I will start the screen of my screen, if you have any questions, and I would like to take this opportunity to say hello to Sami. Welcome to this session this afternoon, and Now the floor is yours. So if you have any questions or I don't know, any other kind of notes that you would like to do, please, this is the time to do it.
No question. Nice review of the last session.
Okay, thank you, Alexandru. So if there are no specific questions, I guess I guess that also Lewis is with us, but without the video. But I hope that Lewis, you can hear us and you are always with us. And then I will share it in the screen. I guess that you are able to see me even if when I share the screen, is it? Because I am not able to see all your faces when I share my screen.
Yes, we can hear you. Yeah.
Okay. So today, the main focus of today's lessons is regarding the creation of this therapeutic relationship. I guess that if you think about your work, of course, I'm sure that you always act like the way in which I am reporting this slide, because for sure in the sport setting, in the sport setting, it is really important that you nurture empathy, trust, genuine interest with the people that decide to start the activity, the sport activity with you. But this is even if more important in when you have a person with a mental disorder, because we will see in next slide that for our patients, I mean patients with depression, with schizophrenia, with psychotic disorders, they experience much more difficulties in creating this kind of relationship due to the cognitive deficits, for example, that they have due to the disorder, or also as a effect of as a side effect of the treatment that they usually receive. And now I would like to show you this short video, and that is about what is empathy, because I guess that empathy is really a very important part of our work. No, sorry, something else.
I think we should explore.
Con la fibra ultraveloce di Tim puoi fare proprio tutto. Lavorare e divertirti senza limiti.
Can you see this? My
fuels connection.
Can you hear? Can you also hear?
Yeah, I can hear and see.
Okay, one moment.
Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So I decided to show you this video because I guess that it is in a very direct and simple way try to explain us which are the main differences between sympathy and empathy. Probably Matteo is already very skilled with all these definitions, because if I understood correctly, you are a psychologist. So basically, this is one of the most basic things that is taught during a bachelor course of psychology. But I thought that it was appropriate also to have this very brief, I would say, description of these two dimensions, because from now on I will say many times that empathy is very important. It should represent the most important thing of our relationship, and so I thought it was very useful to be clear for everybody here today on what is really empathy. I don't know if you would like, Matteo, to add something due to your personal experience.
I only say things about empathy. In our work, mainly on the field, empathy is everything. It's all because we have not much time to explain, to understand what we have to do. We have only to synchronize myself with the other people we need our help. So I try in my work to use more empathy as possible.
Thank you. I completely agree with you, because also I work with people with different kinds of psychiatric disorder, also autism in adults, but also intellectual disability in people that are now adults again. And so I completely agree with you that empathy really represents sort of a cornerstone of our daily activity. So coming back to the slides. Okay, again, why it is important empathy? Because we know that through this, I would say, attitude, empathic, we are able to create a very strong connection with the patient, although we can have that can be different in languages, in culture, in age, in gender, in any other kind of difference that you can see. But when we use this kind of empathetic way of communicating with people, we are really able to create a strong connection with them, and we are really able to engage them in the conversation. In fact, consider that another very important aspect of today's lesson will be also on what is active listening and how to improve our communication skills. Because probably now that we are having this online session, probably you are missing some of the non-verbal aspect of communication, because basically you know that communication is also made of movement, of gestures, of facial expressions, many things that sometimes in the Zoom meetings like these, it is more difficult to really see. But I am sure that we will, when we will be able to meet in Brussels, we will discover many more peculiarities and specific strengths of each of us because of the in-person interaction. And but again, it is very important to be aware of the fact that a good communication includes also all these and when we create this therapeutic relationship, we should consider that we are putting the person at the center of our activities. And I am sure that you, again, already do it in your daily work, although you are not always working with people with severe mental disorders. And so also consider that essential elements of the therapeutic relationship in mental health include also compassion and hope, because in particular the idea of instilling hope, the hope to recover from the disorder, is really another very important and relevant element that we should increase in our patients, because in many cases they have this sort of misconception that having a mental disorder is something that has not really any chance to be improved, while instead we are here for working with the patients and trying to teach them how to make even small steps forward. But we know that even that step by step we are able to improve our activities. And again, this aspect of hope, of the hope theory, is very important for us. Here, Matteo maybe knows this psychologist that was a sort of a father of the positive psychology, because this direction of psychology is really oriented to improve the sense of self-empowerment in our patients, because we know that empowerment is really important for them to become an active part of the process of the recovery. And please consider also that sport is a very useful tool in improving empowerment and hope and optimism, because through a practical activity, let's say a physical activity, you can become skilled in do something, and so you can learn that you are able to do a thing if someone else is there with you and is trying to explain to you that thing, you can learn to do it. And again, it seems a sort of obvious thing, but for people with severe mental disorders, it is not really so obvious, because they experience in every day many difficulties, even doing ordinary activities. And so trying to teach them all these, it's very, very important. And we know also that instilling hope in people is very useful, because increase the probability to obtain, to achieve the goals, to choose healthier lifestyle habits, to recover better from the disorder, to have a higher levels of life satisfaction, and also a stronger sense of meaning and purpose. And all these things are really very important, because are the main features of the concept of recovery, that is the final aim toward which we are trying to orientate the pathways and the disorders. And here I have tried to summarize some practical tips on how to improve therapeutic relationship. First of all, I would say, like we did this afternoon, we introduce ourselves. I told you who I am, why I am here. I told you my name, and I'm not specified, but of course you can call me Gaia. It is not necessary that you call me as doctor or psychiatrist and so on. Another aspect that is very important patients is to guarantee that the privacy and that all these basic needs are met. And then I would say that the last aspects reported here are really the most important. First of all, to maintain a contact. In fact, as you noticed, I have told you some minutes ago that I was quite sort of worried by the fact that now I am not able to see all of you because now I am sharing my screen, because I know that having the opportunity to see you is at least a way to try to understand if I am communicating something useful to you. And but when you are in person, of course, this is completely different. Sometimes you should remember that too much eye contact can be perceived as intimidating with mental disorder, particularly if they have a sort of vision of persecution or they are paranoid or something like that. And then another important aspect is the active listening, and then we will go in more details on how to improve our skills in active listening. And finally, maintain some professional boundaries is again very important for strengthening and fostering this therapeutic relationship. Nowadays, consider that probably we have
Colgado el cabo, ¿verdad? No me carga.
Sorry? No. Okay. Nowadays, I was saying that we have forgotten about the importance of hand holding or maybe hug someone during these times of the COVID pandemic. But if you think about the past, of course, maybe you can agree with me that having this kind of physical contact was really very important to try to create this relationship with the people that you are front of you. So now I would just like to ask you, do you usually some of the things that I have written here, or it is something that you have never had the opportunity to think about? What do you say?
I have a question about another.
Sorry, Matteo, I didn't hear you.
I have a question about another
aspect.
Another aspect. What do you think about motivation? I listened to some things about motivation when you speak about hope, but motivation is about me important things, and also in our work in when we go to teach a sport, for example.
Yeah, thank you for your question, because you are very well focused on the topic of this session, because I will speak about motivation in a few slides, but you gave me the opportunity already to introduce this aspect, because it is a very sensitive issue, the fact of motivation, because in many cases the people are not motivated to pursue any change in their, for example, lifestyle. And so this is the reason why it is very difficult for them to engage in this kind of activity, any kind of activity, either if you propose them to start a CBT, for example, or a social skill training, or also a sport-based intervention. One of the most important limits is due to the fact that they are not motivated to do so. And so this is the reason why I don't know if it is included in this session of this afternoon, or maybe in one of the coming ones, we will have some very practical tips on how to conduct a sort of very short motivational interview, how to identify, I would say, the main strength and limitation of each person, because of course, as you told Matteo, it is necessary to evaluate these aspects, because this can represent another way to engage people trying to improve their motivation to do something. Otherwise, the rate of the dropouts can be very high if they are not motivated to do so. So thank you really for this question, because it's very specific and really very important for performing this kind of activity that is the one that you are expected to do in the next coming months. But Another question from my side was when you approach for the first time a person in your ordinary practice, let's say, how do you approach them? What do you do? This is my personal question to all of you.
I usually try to not lower to the level, but try to be not superior, not trying. Also, from what you said about the prolonged visual contact, not to do this, and also not to make the body language. I mean, not to stay like this or like this or like be the bossy of the. So I try to stay neutral in talking and corporal language, let's say.
Yeah, okay, I see. Thank you.
Yeah. And about the empathy, empathy, either you have it, either you don't have it. I mean, you can simulate sympathy, but empathy, if you don't have it, you cannot work in this field.
Yeah, exactly. And in fact, I guess that year by year, while you accumulate, I would say, your professional experience, maybe you become even more skilled in become an empathic person and try to improve this aspect, because it is very, as you probably are saying now, it is very important to have empathy. Otherwise, you cannot do this work. Neither me, from my point of view as a medical doctor, neither you as a sport trainer, a coach, because of course empathy is really essential elements. And I guess
you cannot feel them, and you cannot have a connection with them if you don't have empathy. I mean, it's easy.
Yeah. Okay. Thank you. So coming back to the slides. Now I would like, if you like, to make a sort of very short role play on communication and how to create a therapeutic relationship. Let's say that I would like to create a situation in which one of you is the coach, so the things that you usually do, and the other one is the new client, so a patient with any kind of severe mental disorder. Just because I would like to see how would you approach a person with this condition. Of course, I really hope that someone is available for volunteering. Otherwise, we will need to skip the role play. But please, if someone, just 2 people are necessary for doing this task. What do you think? It's too difficult?
I can be coach.
Okay.
That will be fun.
Okay, so you will be the coach.
Okay, that's fine.
And I can be the trainee, no problem.
Okay, you can be the patient, so.
Okay.
Okay, so the floor is yours.
Okay, just improvise.
Yeah.
Okay. Hey, Alexander, how you doing?
Hello.
Hello, how you doing right now?
I'm very tired today. I don't know. It's very. It was a long week. I'm very tired. I don't know. I don't feel so good today.
Okay, it's okay. But if we do some sport right now, do you want to be with our group to do just like your style, no pressure at all?
I don't know what kind of sport. What kind of?
I think we play football today. Do you like it?
It's okay. I can only if I stay the goalkeeper.
Yeah. I asked the others if there's no like other options and we everybody can be goalkeeper in this team.
I don't like to run a lot.
You can be, and if somebody else can want to go in goal, then you can be on the bench at this time and go back into goal if it's okay to you. And the most important thing is that we have fun today, and you get better 2 hours at this moment than your week have been. So that's the most important thing for me.
Okay, then I'll start as a goalkeeper and.
Nice. Let's have fun together.
Okay.
Okay, so thank you very much for having accepted this invitation to volunteer. You did, I guess, very well. But also, I would say that Alexandru is a sort of ideal patient because although he feels very tired, he at a certain point started to say, okay, I am available to practice a sport, to be the goalkeeper and so on and so forth. So really, I would say that in the ordinary practice, I guess it's much more difficult than this. But of course, this is just for joke. But again, I would like just to highlight the type of communication skills that also Sami used, because for sure you have noticed that he has tried to involve actively the Alexandru in the conversation, has tried to say, okay, how are you doing? So a way to create this kind of relationship. And I guess that it is everything is much more complex because we are in this virtual setting. Of course, this makes things even more difficult than the real life interaction in person. And again, I guess that you did very well, and I am very happy of this. And but I guess that we can think about some specific aspects that you, I guess, for sure already use in your practice, but probably I don't know if you have had the opportunity to think about that, because also during this rehearsal, Sami has used some skills of active listening, because he has tried to reframe, to reuse the words that Alexander used in order to show the fact that he is really interested in the things that are going on. And also, although this is a virtual setting, Sami and also Alexandru has used this active observation. So they are very focused also on the non-verbal aspects that are used during communication. And again, I'm sure that you in your daily practice already do like that. But today I would just like to put your attention on the fact that these aspects are really very, very important, particularly when we deal with people with severe mental disorders. And when we use this active listening, what does it mean? It means make questions and make some remarks on what the person is saying, and also use non-verbal elements like nodding, like make a contact. All these are aspects of the active listening, while instead the passive listening is listening without reacting or responding. And probably also I am trying to stimulate your active listening while I interrupt and ask you things, just to be sure that you are on track and you are following me in this lesson. And I would say that probably some examples in which we usually use this passive listening is, for example, listening to the news, listening to the music, and so when it is not really possible to interact with the other people. But apart from this condition, I would say that in every other conditions we usually should use active listening. And here are some tips that you already have told me. Alexandru was saying that body gestures is one very important aspect, like the fact of give feedback or keeping the contact, are all elements that are very, very important to improve our way of communicate with the other person. And again, I am sure that all these aspects are already an integral part of your way of communicate with your people that practice sport activity, usually with you in your youth practice. And again, very similar to the first one. Now I will just show you this video that was about what is active listening role play. And let me go to this link. No. One moment. Can you see it?
So today we're going to do a quick little active listening demonstration. And I'm going to be an observer, and Susan is going to play the role of a coach, and Kumari is going to play the role of a coachee. And what we'd like you to look for, and what I'll be looking for as the observer, is the 5 steps of active listening. So let's see how this works.
Can you hear the videos?
Yes.
Yes.
Okay.
Great. I'd like to talk about today.
I have a coaching client, and I want to make sure that I am being an effective coach in this relationship. I don't know if I'm doing her any good anymore, and I don't know whether it's my own self-judgment because I've checked in with her. I've said, you know, is this serving you? And she says yes, and she's affirmative. She says she gets a lot out of every call, but it's an ongoing relationship that doesn't seem to have an end goal for her. I mean, she prefers not to. And yeah, I guess I don't want to keep taking her money, you know. I also enjoy, to some extent, the connection that we have. And I don't know whether it's me wanting to push her to get to get change in her life, and she's not ready for it. And so I just need to give myself some empathy about that, you know. Or maybe she's not the kind of client that I want to work with. I want to, have maybe more results oriented. So I'm confused, and that's a little bit about it.
Okay, great. So what I heard you say was that you've got a client. It's been a client that you've had a relationship with for some time, and you're not really making a lot of progress with this client. You're not sure if she's all that concerned about it. She keeps telling you that everything's okay, but you're feeling like you're just not getting anywhere. And how you're interpreting the situation is that you're wondering whether or not you're really giving her good service, if you're providing value for her and making a difference. And so you're feeling a bit frustrated, a bit confused, and just kind of in this, I don't even know what to do next. And your commitment is really to make a difference for her. I mean, you really want her to resolve the issue that she's struggling with and help her. Did I get that?
Yes. Yeah, and of course brought up many other things I want to tell you, but yes.
Great,
yes.
Thank you.
Great. And so as part of the debrief here, quickly, Kumari, how did it feel to have that reflected back to you as the coachee?
It felt enlivening. It felt, again, like I said, it kind of got to gush out more, okay, and this and this and this and this. So obviously there's a sense of trust. There's a sense of support, and that she's with me, and has also helped to illuminate these different areas. Okay, separating out what is maybe fact from what is what I'm telling myself, I'm interpreting, and that helps me clarify.
So you felt heard, and it made you want to open up and go in another step. Correct. Great. And Susan, I thought you did an excellent job on the 5 points, and I think when we put titles over this role play, it's going to clearly show. But do you feel you hit all the points of the 5 points of reflective listening?
I felt like I did. I know that the challenging sort of aspect of doing this kind of listening is that it's different, and sometimes you're so so concerned about, oh, am I going to get all the right information? And it's really just a practice of being present with the coachee.
Right. Well, very good. Well, thanks for helping us with this demonstration today.
Good.
Okay, I guess that this video was very, very straightforward, easy to follow, and also very impressive, because here you can see some very core aspects of what does it mean practicing active listening, because as you can see in the first part of the video, the old lady made this sort of reframe of the things that the young lady has told to her, and of course this activity of do the reframe is really very important when you are trying to use these active listening skills. And at the end, also the fact that the old lady has provided a feedback on the context or the aspects that have been discussed is another very important element of active listening. So I would try to invite you to try to start thinking in your interaction with the people, in particular when you will select people that will participate in your pilot action as part of the EASM project, to use these kind of skills, because really they can make a difference in the way you are able to engage people with severe mental disorders, because of course it will be completely different to use active listening with the person with, for example, autism, because of course Matteo can explain us that autism is a very difficult condition in which the relation with the other is completely disrupted, I would say. So of course it's very, very, even if more challenging to create this kind of active listening, but in any case, I'm sure that he will try to do it, because of course using also the non-verbal way of communicate, this can be useful to foster this kind of communication. But also with other kind of disorder like schizophrenia, for us it can be difficult to create this communication, but I can assure you that while using active listening, it is always a good strategy to try to improve the opportunities for you to succeed in obtaining the goal that you have defined. Okay? I don't know if you would like to add something or make any remark.
Okay, go. It's okay.
Matteo, go ahead.
About autism, I'm would tell you an episode when a children pass me the ball, children that non-verbal children, not speaking, is I'm very happy, because is a way to communicate with me that person that not communicated with me. So in the football, the way to communicate is pass the ball. I have another question, but I forgot.
Don't worry, it will come again in your mind. Okay, Alexandro, please.
Yeah, no, so I understand that pretty much what Susan said. The old lady was just repeating the problems that she had, so you just repeat it so you can hear it from somebody else, so you can analyze it.
Yeah, exactly.
Okay.
It is a way to, I would say, like put your in the shoes of another person. So repeating, let's say, the things that I am saying, it's a way to show you, to confirm you that I am really engaged in the things that you are talking about. And so this is a very effective way to foster this relationship with the other person. And again, it is really, really important when you have people with mental disorders, because they feel like they are not really valued in everyday life. So meeting people that do like that, it's really, really important for them, because they see the difference.
Okay. Yeah.
I remember the question. It's about to encourage the people to speak, the people who want to speak, or it's difficult for them. Is it right to encourage them, or there is another way to try to speak with them?
This is another very good and difficult, I would say, question, because we should consider the global context in which the difficulty to speak is included, because of course, as you told us, when you have a baby or a child with autism, it is very common that they do not use verbal communication. So of course, in that case, you need to use this other alternative way of communication. Different is the case when you have a person with schizophrenia, because, for example, in that case, you should not go directly to the main topic of his or her delusion, but you should try just to start to make a conversation of his or her ordinary life. What did you do yesterday? How do you usually spend your day? And try to see if question by question, step by step, even small step, you are able to try to obtain some words from that person that is very, I would say, closed in his or her inner world. But of course, this is something that requires sometimes many clinical encounters with the patients. So of course, the video that I showed you, it's a sort of it's a way to simplify a very complex phenomenon that is even more difficult when you work with these patients. But I guess that I have also selected some video in which we have people with the mental disorder. Let me go to again to the slides. Here, for example, I have reported to you some examples of how to improve your active listening. So as Alexander was saying, probably using this way of restating the things that the person has already told us, it's a way to show them that we are really interested in their information, the things that they are saying. Of course, maybe also use this technique of summarizing is very important. So because it means that I have had to be very engaged on the things that you were saying, and so I am able to select just the most important thing. So even another strategy can be clarifying, can be encouraging. So encourage to keep talking, for example, using suggesting different ideas, different things. Okay, so you say this, so how can we manage, for example, this situation? And I can suggest, okay, I would do like this or like that. And so all of these can be a way to promote the conversation and also to improve our active listening. And so again, I will send you by email with the help of Stefano these slides, so you will have also these handouts as a possible suggestions on how to improve your active listening skills. And here again, I have some examples. Let me show you, because I guess that these are very very important for
Hannah. I talked with you, I know, the other day, but I just wanted to touch base today, you know, about your stuff, your situation. So I read your chart, and I know we talked last time. Are you still feeling depressed?
Yeah.
Depression, so okay. Depression. And I know you're feeling depressed now, but I felt depressed before, and it will pass. Like, you'll get over it. It's not that big of a deal. And so this depression, why are you feeling depressed?
Well,
Oh, wait, sorry, I had another note. Something else I wanted to ask you before. No, why, or is that depression what brought you in here?
Well, I OD'd earlier.
Ooh.
Because I was
Depressed?
really sad.
Yeah. Okay, so that overdose, we'll have to talk about. So then why are you feeling depressed?
Well, I was abused earlier. I just don't.
I mean, your life doesn't.
deal with-
I looked in your chart, and your life doesn't seem all that bad. So this depression, I think you can get over it. Yeah. Let me look at my notes here. I know we saw some stuff. Oh, hey. Yeah. Can I talk to you later? I'm gonna finish talking to her. Okay. Sorry, I lost my train of thought. Let me look at my notes here. You got the abuse, the overdose. So can we talk about these thoughts? Oh, that, like, that area. Do you want to, are you still having those thoughts?
No.
No? Okay, then. Great. No thoughts? Because I know, I mean, if you're having them, it's kind of like, why, I don't understand why people think of, like, killing themselves. It's really very weak of them to do. Personally. But anywho's, oh, hold on a second. Hello? No, I'm at work right now. Yeah. You know at Belmont? Yeah. I'm going to talk with this patient here. Yeah. And I'll call you back. Okay. Okay, bye. I'm sorry. Yeah. Anywho, so let me look at my notes. But so you, those thoughts we were saying, what were you saying about those? Did you have them? I forget.
Well, no.
No. Okay, that's great. I'm glad. So are you feeling better then?
I guess a little.
Yeah. So what do you think has worked in your therapy?
I like talking to the therapist.
One-on-one?
Mm-hmm.
Okay, well, do you want me to see if your doctor's available? I can
Yeah.
totally arrange that. Okay, I'm going to go check that then right now.
Okay.
So now I am asking you, what do you think about the communication skills of this? I don't know if she's a nurse or a doctor and the patient. Was she empathic or using active listening or doing something like the things that we were discussing?
Lack of professionalism.
Mm-hmm.
And yeah, not paying attention to what the patient is saying.
Okay, so you mean she was not really professional in her role?
No, it's obvious. It's
Okay.
not prepared for nothing. Yeah.
Yeah. So definitely, I would say it was really an example of poor communication styles, or she summarized all things that should never be done when you are with a patient, because of course you cannot use this way of make jokes or interrupt by phone call or not being really interested in the things that she is saying about her condition and about all things going on. And I have also another example with the communication with patients with schizophrenia that also I would like to show you, because I guess it's very, very important to try to consider what does it mean. One moment, I will show you the screen.
Beverly? Beverly? I noticed you haven't come out today. Can I come in?
Those girls are looking at me. They're laughing at me. They've been laughing at me all morning.
I doubt they're talking about you, Beverly. Can you come out from under the sheets, please? And I noticed you haven't had your breakfast. Is everything okay?
It's true. They're laughing at me.
I don't hear anything. Beverly, why haven't you had your breakfast?
Those girls are laughing at me. Can't you hear them?
I don't hear anything. I doubt that they're laughing at you. We're all here to help you. Can you come out from under the sheets?
They say they're gonna poison my food.
They say they're gonna poison your food? I doubt that they're gonna poison your food. Can you come out from under the sheets, please?
They've been saying it all night. I haven't slept. They've been saying it all night.
Well, come out from under there and we'll talk about it, okay? Beverly? Can you come out from under there and we'll talk about what happened last night? Please? Hi, good morning. My name is Jenny. I'm going to be your nurse today. Remember me from yesterday? What happened with your food? Why haven't you had your breakfast yet? I'm going to grab a chair and I will be right back, okay? Okay. Tell me what's going on. What were they saying? What was going on last night?
They're laughing at me. They said they poisoned my food.
They are, okay, they are not poisoning your food. I doubt they're poisoning your food. What happened last night? I heard you were supposed to shower. You didn't shower.
They said they were going to put a camera in the shower and then videotape. I was showering.
They were going to videotape you showering. I doubt that. I doubt that.
That's what they said.
Okay. One thing at a time. Would it be okay if I went to go grab some fresh breakfast and I'll bring it? Maybe we can eat it together? And then we can talk about it some more. Would that be okay? I'll grab a fresh bowl of food and we'll eat together. We'll have breakfast together. Is that okay? Beverly? Is that okay? Okay. I'll be right back, okay?
Okay, so as you can see here, the way of the style of communication was completely different from the previous one. In this case, the nurse or the doctor, we don't know the exact medical role, was very trying to be empathic with the patient. And as you have noticed, many times she called the patient by her name. That is another way to try to reduce the distance between you and the patient. Is trying to as you have seen, she has tried to summarize the main theme of the delusion, because probably the patient is frightened by the idea of being poisoned by someone. And so she's saying at the end also, if you like, I will eat with you just for showing you that everything will go fine. And so I guess really that it was a very good example, even of the way for representing a patient with schizophrenia, because I don't know if you have had the opportunity to talk with the patients with schizophrenia, but I would say that really in our real everyday practice, it is like that, like the video, in which they are very, I would say, locked in their inner world, in their delusions, and so it is very difficult to try to enter in their world. And so trying every kind of strategy to do like the women in the video did, I guess is really a good example of what we should do in everyday practice. So I don't know, any comments, any?
So can I ask one question? What would you have done if the patient would answer that no, I'm not gonna eat with you right now? What would you ask then next?
Next, you will say, okay, you know, it is quite a very common thing that happens in our clinical practice. And at the end, you will try to say, okay, but now I will wait, for example, for you for a couple of minutes. Let's say, let's wait a little, or maybe sometimes I use also to ask, but why? Do you like the food? Would you like to eat something different? I can stay with you. Maybe you can start eating a small portion and then you will finish. You know, trying to make also sort of compromise of what you should eat and what you are really able to do. And again, sometimes you should also be very patient with these people, and just to be happy of the fact that even a small goal is achieved, because for them probably sometimes it's really a big effort to do the things that you are asking them to do. So maybe learn how to respect their time and the fact that they have an own time and own dimension, and you have to accommodate their needs. Maybe this is my suggestion.
Yeah, and I think because I worked with like mental health sector 4 years, 5 years, I would go in past like questions that how long have you like have this kind of situation, and like if the patient realized that this could be like something in past, and then probably she would like realize this is not real. And I would go like past questions that have you been like this kind of situation before, but if the patient would never be in like same kind of situation and don't realize that this could be like a schizophrenia symptoms or something, then I think it would be very hard to like have the patient believe that this is not real. But if there is past something tells the patient that this would be not real, then I would go there to ask those questions. That would be my like.
Yeah. And I guess that this would be a good strategy, because, you know, when the patient, for example, schizophrenia patient, have these delusions, if they are in a very vivid phase of the disorder, it is not really possible to try to explain them that the delusion are unrealistic or are false beliefs. So it is better to try not to continuously speak about the topic of the delusion, but just discuss about other things, because really it is not possible just by talking therapy to try to pursue them that the belief is false. Of course, in that cases, we also need some drugs, for example, antipsychotic ones, that really have this effect on reducing the intensity of the delusion. And then after that, you can start to discuss with them that probably this delusion was a sort of unreal thing or something like that. But thank you for your observation.
Thank you.
You're welcome. Okay, I'll come back to the slides. And now I will go to the part of the slides in which I have summarized the fact that Matteo was telling us the aspect about motivation. But first of all, let me give you this very brief overview on the fact that people with severe mental disorders have this problem of a very low expectation, life expectation, because they in general have a life shortened of up to 20 years compared to the general population, because they suffer from many cardiovascular diseases, obesity. They also are sometimes heavy smokers, and in particular, they are very sedentary people. And so they, as you can see here, they engage in significantly less vigorous exercise. They are very sedentary, and so and also it is very difficult to start any kind of physical activities with them. And the reason is that written here, that when we try to invite them to start with a sport-based intervention or physical activity, this is a scientific article in which authors have tried to understand which are the most important motivating factors for deciding to start to do this activity. And as you can see here, obviously they say, okay, I would like to improve the physical health, but you can see also that they say, okay, because it's just doctor advice. And you can easily imagine that, of course, when you are trying to do it just because someone else is suggesting you to do, of course, the probability to be successful in completing this task is very, very low, because, of course, you are not really motivated in do so. So our work should be, and your work in particular, should be to try to motivate people on how and why it is really important to be involved in this kind of activity, like sport activity. And at the same time, we know also that there are several barriers, several obstacles in accessing this kind of intervention, because first of all, as you can see here, people feel like not interested in these activities, did not have enough support, are very tired, or maybe have fear of injury. And so all these aspects, of course, are the aspects on which we would like to work during this training course, and also in with the EASMH project, because when people say there is a lack of support, it is probably because also sport coaches are not really skilled in how to deal with people with severe mental disorders. So I have provided here you with some, according to me at least, practical tips for how to engage patients with severe mental disorder in a sport-based intervention. Probably, first of all, I would like to evaluate the expectation of the patients toward this sport-based intervention. Then evaluate the personal attitudes. So I would like to ask people questions like, have you ever practiced any sport during your life? If yes, what type? If not, why? And why I would be interested in this personal attitude? Because of course, if now I am a young lady, I am almost 55 years old, and if you ask me, have you ever practiced sport? I would say yes, volleyball when I was adolescent. Probably it would be useful to propose me, okay, so you have already practiced volleyball, so probably you will you have enjoyed it, and probably you are a little bit already skilled in playing volleyball, so please start with volleyball, because of course starting from a skill that I have already acquired in my life, it's generally an easy task, an easier task than starting a thing that I have never done in my life. And so this is the reason why it is so important to evaluate the personal attitudes. And finally, you should describe to them the potentiality and the utility of performing this sport-based intervention. Again, I really would like that you you think about these practical tips, because I am not, of course, a sport coach, so I don't know if you usually do like that, or you just propose people to do a physical activity, and not because of your personal orientation or personal things in which you are already involved in. But I guess that this is instead really, really important. For example, these are some examples of how you should start this sport-based intervention. For example, using a fun game-based format, minimize the ideal time between activities, program flexible activities in order to adapt to the different needs of the patients, and provide also clear instructions of rules, skills, techniques. And I really guess that Matteo probably, considering that he usually works with the children, I guess that already used all these tips, because really I guess that working with children and working with the children with autism spectrum disorder or intellectual disabilities requires that you are very open to the necessity of these people, because of course you cannot give them some very strict rules and wait that they will follow your rules, but you need to adapt to the conditions and to the necessity, to the abilities, skills that they already have. And So my question to you, how would you approach a patient with severe mental disorder? How would you involve him or her in the program? Do you have any, now it is just for having this final part of the discussion together. What do you think about also the practical tips that I have shown to you? What do you think? Would you use an approach like this, or you go, for example, if I go to, I don't know, to Alexandro, if I come to you and I am a patient with, I don't know, for example, with anxiety disorder, which kind of sport activities would you propose to me? Because if I understood correctly, you are a kinetherapist and involved in a basketball team. So basically, are you going to propose me, okay, try to be involved in a basketball team, or do you have any other suggestion for me?
I don't know. Depends. As you say, depends of your sports background. I don't know. I mean, if you had any other skills than basketball, I don't know. You cannot dribble, but you can run. I don't know, for a long time. Okay, so let's try athletics, or let's try, I don't know, something else. Rope jumping. I don't know. I mean, if I'm into the basketball system or program, I cannot, I don't know, make you like also basketball. I mean, we can adjust, depends on your skills, on your interests. I don't know.
So you would use this kind of personalized approach, evaluating first of all the things that I would like to do and the things that I have already done in my life, in order to personalize and create a program that would be adapted to my personal skills.
Yeah, so as with these persons who I work with, we are trying to play some football and basketball. But one girl said that she saw the tennis court and she was like, I want to play tennis. Okay. She had no skills for tennis, but I bring two paddles and a ball, and she was like, I don't know, after 5 minutes that she saw she cannot hit the ball, she was okay, let's go back to
basketball.
Yeah.
I see.
Yeah.
Okay.
So this is, I don't push them. I just, okay, let's do this. And maybe I expect them to realize that they cannot do it, but I let them try. Okay, let's do this if you like it or not, or I don't know. Mm-hmm. But I don't push them to do whatever.
Okay, I see. Thank you. What about the others? I don't know. For example, I guess, Matteo, that in your case, you told me that you are a football coach. So basically, when children come to your, I don't know, sport club, I say, they already know that they are expected to play football. So they cannot say, I know, I would like to play tennis, like in the case of Alexandro. Is it?
Yes, the activity is more specific. When, for example, children start to attend our activity, the way we approach them is various, because there are a multitude of possible things that we have to observe. For example, some children, we have to give my hand to conduct them into the field. Other one, I call children that is already to our already into our activities, and we we could meet together to a specific exercise. But the first things we do when children arrive to the sample is a circle time. I present myself, the staff, and the other children to mi viene in mente clima sereno.
Yeah, so a very friendly situation in order to make them comfortable in that situation and to introduce also themselves, if possible, if they are able to do it. Otherwise, you will do it with your team.
Yes.
Okay.
And I write a short chart list to note the characteristic of the children. If is verbal, non-verbal children is need some special things, can stay far to our parents.
Yeah, okay, I got your point. Okay, yeah. So I will say that your situation is completely different from the one by Retu or by Alexandru, because of course you are already, I would say, with a specific orientation to play football and to work with just children with this kind of disorders that of course have some specific needs. Instead, the situation of Alexandru is different because of course he has the idea that he needs to adapt to the request and to the needs of each person, each women that he will be in charge of. So I guess that these are two different points of view, but both are very interesting. And I would like to understand also if for the other, how does it will work? So it will be most similar to Matteo's situation or more similar to Alexandru's situation? This is just my curiosity because, you know, of course, for the practical one, for the practical part that you are expected to do in the next coming months, of course, the practical activities performed by Matteo will be completely different from the one performed by Alexandru. So I will just say that both are fine, but it is just for me to understand in which kind of situations I will have to manage in next coming weeks. I don't know if I was clear enough. No? So for example, I don't know, Sami, if a person come to you, how would you approach he or her, him or she? I mean.
Yeah. Actually, I don't listen like lately, but I would approach like if I have some plan what we do today, and I know the group like the other people in the group. I try to integrate that person like the best abilities what he or she can do on that group. And like ask, of course, in that person also that is this like role good for you and enough for you to be part of this group. And there maybe there's some be like some situation if the group is like professional football players and there come like person with several mental issues, it's not the right group for that person at this moment. Then I try to find another group for that person where he can be happy and have a like sport at his level. I think that way.
I have just a question for you because I missed one information. Are you from Finland? Is it?
Yeah.
Yeah. Okay. And in your daily activity, in what does it consist? What do you do? Are you a sport coach in general?
Yeah. Right now, actually, I'm doing an app where people can help each other. I'm a startup founder, but my background is that I'm a nurse and I worked in mental health sector before doing this app.
Okay, okay. But do you have also any skills in sport activity? I mean.
Yeah, I played football like 20 years, quite professionally, and I've been coaching 2 years. But
Okay.
it's been hobby for me. But I like it. I actually love it, and maybe one day I want to do it like high level. But right now I don't have time on that.
Okay, okay, okay. I see. I got your point. And my last question for you, Sami, but it is just my again because I would like to know each other in a better way. So basically, do you know that at the end of this course you are expected to do this sort of a practical activity with the patients, with a couple of patients?
What kind of practical activity?
Yeah, this is the problem. This is the point. In the next sessions that we will have,
Yeah.
I will explain you the idea of what does it mean performing this practical activity, and the fact is that we are expecting you to develop a sort of personalized program for people with severe mental disorders, but basically not only to prepare this from a theoretical point of view, but also then that in the coming months you will help patients, real patients, to do it. So my question is, now you will have the opportunity to involve patients, or now you are just moving in developing this app and that's it?
Yeah, no. It's my daily job, but I think this is like the other thing what I want to do in the same time I do the app.
Okay.
Do you get my point?
No, not really. So you are in your spare time you are doing the app, but you also work like nurse. No, I don't understand.
In daily job I do an app right now, like 8 hours a day.
Okay, okay.
Yeah. Another time I want to be part of this and do whatever I do in my own time.
Okay.
Do I have understand right?
Yeah.
My question.
Yeah.
Because I don't expect that this is for me like 8 hours per day.
Wow.
Yeah.
Okay. So, okay, but in any case, we will coming back to this topic on how to develop this pilot action also in next sessions, and then we will have the opportunity to continue to discuss about this. So just because now we are running out of time, I will just coming back to the slide just to be sure that we have finished. But I guess so. Yeah. So my first slide was about the question and answer. So yes. So we have almost 15 minutes if there are other questions. Otherwise, I would like to ask to Retu and Serbu instead. I understood that Retu, you are involved in football and you are a supervisor of football things. Okay.
No, I am a supervisor in school at the afternoon club.
Okay, but when you speak about supervisor in school, what does it mean? Because you know it is a
supervisor afternoon club.
Okay, afternoon.
Yeah, work at school, and the afternoon club is after the school.
Okay, okay, but it is always focused on sport-based intervention on football activities. You mean?
It's based on sports.
Sport in general.
Yes, yes.
Okay, okay.
And it's the organized behind it's EASMH, which is sports organized, football organized.
Okay, I see. And so, and if I understood correctly, you just work with children. I got your point.
Yes.
Okay. And basically they are, I would say, children, normal children, or children also with any kind of, or mixed?
Yes, there is also special needs.
Okay, children.
Yes.
Okay. So basically you are sort of similar to the condition of Matteo, but Matteo just worked with intellectual disabilities and autism. Okay, okay, now I got your point.
Actually, now I understand your question. Like, first, I'm starting my own like sport at like football group or floorball group in Nokian palloseura near to Tampere, Finland, for adult mental health peoples.
Okay.
That's what I will do in this possible future. Yeah, yeah.
Okay.
If that's what your question actually was that was. Yeah.
Okay.
I try to integrate like mental health people group in like football club, part of football club, like, because there is no Finland, in Finland there is no like not much football clubs who have different groups for people who are not doing sports in like a high level or like with mental health issue, and we're trying to integrate that kind of group for.
Okay, brilliant.
That's I think the question you asked for me.
Yeah, thank you.
Thank
and
you.
Then we have Serbu, that if I understood correctly, you are a fitness instructor doing basically aerobic activities.
Yes.
Yeah, okay. But you told me that you usually work with, again, healthy people, I would say normal people without mental disorders.
Normal people.
Normal people, okay. But for the aims of this project, we will need for you to try to work to make this aerobic activity with people with mental disorders. Would you have the opportunity to identify these people? I mean,
Yeah, understand. Hard to speak English, but
okay.
understand you
Okay, so
speak.
it is not a problem. Okay, okay.
Yeah, I'm interesting for work to people disability.
Okay, and finally we have
I can
Alejandro.
intervene just a second. I was talking with Julian, so he was helping me with this video running. So he came over there and he helped me with the warm up with my team. Let's say, I don't know how to call them. It's a So he was over there and he was helping me with the warm up, and we try to run with the kids, like I don't know, try to, because one of them go real fast, one of them are slower, so we just ran together with them with on the course. So he was there and he helped me, and I will try to get him on as many as training session as he can come. I don't know. Yeah.
Okay.
Thank you, Alex.
Thank you. And then Alejandro, what about you? I remember you work in rugby. Sei muto?
Sì, sì.
Okay.
Yeah.
Okay. And do you have also patients with mental disorders or not?
Now, se ho capito bene, se chiedi non so se ti ricordi che con l'inglese mi devi aiutare, no?
Sì,
Dico, mi dice se attualmente se lavoro ragazzi di disordine o tipo disordine. No. No, attualmente, ma vabbè, ti dico in italiano se mi aiuti te. Stiamo nella federazione italiana del rugby, stiamo facendo un progetto che partirà a settembre, che io sarò, diciamo, responsabile in tutta Italia, che si chiama Rugby Integrato, che sarà per lavorare con, diciamo, tipo mixed, dove consideriamo il rugby, lo sport, come un mezzo, e quindi utilizzeremo anche se come rugby multidisciplina per poter farlo con ragazzi con con disordine mentale.
Ma che disordini? Non lo sai? Autismo sempre, disabilità intellettiva?
No, non ci sta un limite con tutti i tipi di strutture, si sta creando un gruppo specifico nella federazione che contatterà, diciamo, delle strutture e non ci sarà un limite per dire che tipo di disordine, di disturbo, sì.
Okay,
Però
so
la idea è creare una struttura dove non siano loro, perché attualmente esiste, ma si fanno dei gruppi dove stanno per esempio ragazzi autistici da soli. Invece attualmente da settembre intanto partiremo con la formazione degli allenatori per creare delle attività che possano farli tutti i ragazzi, ma diciamo mix, diciamo con ragazzi chiamiamo come tu dici normali.
Okay. Yes. No, I do not like the word normal, but it is just for
Sì, no, nel senso così. Sì. Tra virgolette, no, infatti no.
Yeah. So now I will just try to translate. Alejandro is involved in a rugby activity, and basically he will start in September to work with this new project called sort of integrative rugby, in which they will aim to create a sort of mixed team in which there are people with different disabilities and disorders, and so this will be the main aim. So for next time, I will do like this. I have taken some notes of this session this afternoon, and I will put in a Word document. And so next time we will start from that document, just for be sure that I have understood the specificity of each of you, and just because during these training modules, we also need to help you develop this pilot action that you are expected to do in the next coming weeks. So I will prepare it, and then I will share with you, and then we will move on. And from my point of view, I do not have any other questions or remarks. If you have, please do not hesitate to ask me. I'm just trying to, next appointment will be next Wednesday on June the 1st, and it will last 1 hour and a half, starting at 3 p.m. Italian time. And other questions?
No.
Okay. So it has been really a great pleasure for me to be here this afternoon with you, and I hope that you enjoyed it, and I will see you in 1 week. Okay? Have a nice day. Have a nice evening.
Thank you.
Bye-bye.
Bye.
Thank you.
Bye.
Bye.